And relax yourself. Good. Okay, and the other side up. Here we are, day 2 for Parker. I guess let's start off by asking you how you're feeling, Parker.
Good. A little bit better.
Okay.
So maybe a tad bit.
Okay. He's not sore, or was not sore after the adjustment. So right now we're just doing cold laser here. And what I'm going to do with this laser is scan his back for inflammation, areas of inflammation, as this laser can do. And then we'll dose those areas specifically. And the reason why I'm doing the laser here is because this is where the rib head is, right? This is where the rib attaches. And there it found an area of inflammation. We're going to dose that. So we want to make sure all the soft tissue is loose around the rib head so he doesn't have any issues with the other end of that rib, which is, in the sternum area. And we're going to also laser that as well to calm the inflammation down. And I told you before that we're just using more on the surface of the tissue. So we're going to go with a deeper inflammation, a deeper laser treatment next week, okay? I just want the symptoms to go down a little bit before I do that. And this laser right here, this blue one, will tell me, when to stop dosing the area. So it's really nice to have that feature, especially because you can't see underneath the tissue. Sometimes you can see inflammation and feel it, but there are other times you just can't see as a practitioner. You need other tools, MRIs, ultrasounds, things like that to see deeper inflammation. And this allows me to see inflammation a few centimeters deep into the tissue. Not physically see it, but be able to detect it. And we did the right side before. The reason why we did the right side and left side is because really his whole thoracic spine is locked up. So this helps to not only reduce inflammation, but reduce muscle spasms as well. So it certainly can't hurt to do the other side, but we obviously want to focus on the side of pain, which is your left side, right? Or yes, I should say correct, not right, right? That'll get confusing. So at this point, what have you tried other than, you said you did some acupuncture, right? Massage, cupping, physical therapy. What did they do for you in physical therapy?
Just the cupping, light massage, stretches pretty much.
In the chest area?
Yeah.
Okay.
Chest and back.
How long ago was that? Physical therapy.
I did like on and off here and there.
Okay, and did you do it? Okay, so and that may also be the reason. So when you do have costochondritis, it's really important to stick to the recommended care plan. And it does take 2 to 3 visits a week for, anywhere from 4 to 6, some severe cases even longer, even 12 weeks we've had it. But that's where the laser can speed the process up. So because we only have you here in town for a week, that's why I jumped right to the laser. Did you ever have any trauma to your chest or anything? Like when you said you played a lot of sports?
No.
No?
It's more so in my back, like my upper back.
Did you have any trauma to your upper back or mid back, like playing any like lacrosse or basketball where you got elbowed in the back or anything like that? No, nothing you can think of.
I mean, I used to lay on this like spine thing. It's kind of hard, so right spine thing. So I used to lay on.
So right.
Yeah. I used to lay on it, and it was like the spine thing. It's kind of hard. So I don't know if I
messed it up doing that.
Rolling on that thing or whatever, but maybe it could have been that. It also could have been like me rolling out and like pushing my neck forward and then something popped in the back. I don't know, but.
So flip over on your back. Now we're going to scan the chest area, checking for inflammation. You notice I start away from the area, the injured area. There it beeped, found some inflammation there. So as we get a little bit lower, your floating ribs, these are your lower, mid to lower ribs right here. So a lot of times people ask me what can cause costochondritis. You know, it could be even like something as like a case of bronchitis, a bad case of bronchitis where you're having a coughing fit. It could be scoliosis where there's a deviation in your thoracic spine, throwing your ribs off. It could be trauma to the chest, bodybuilder just lifting too hard with the chest muscles.
Trauma to the upper back too?
Yeah, to the upper and mid back as well as chest. Like getting hit, you know, in a football or lacrosse game, getting hit hard, like in the ribs, or you know, something like that can certainly bring this condition on.
I think it started 100% in my upper back.
Okay.
I don't know what I did.
And SoRite has a product for the psoas that I'm familiar with. I did a product review on the SoRite
Like
for the psoas. Yeah, it's not that thing, is it?
No, so it's
a
one
different-
spine.
Okay, I'd have to take a look. I haven't seen that one.
It's like it's hard though, so I don't know if I should have been doing that or not. But
Were you having some upper back pain prior to that, though? You must have been. Otherwise, why would you have bought that or laid on it, right?
I mostly bought it for my lower back.
So it found a few areas of inflammation here that we're lasering, and it's going to tell me when it's done dosing, and then we're going to adjust the thoracic spine. I've already given him the stretches. Have you gotten a chance to do any yesterday?
Yeah, I did better.
You're doing those 3 pretty much?
Yep.
Sticking to the 3?
Yep.
Okay, and then the other one, if you have one of these balls, you can just, obviously on the other side,
Yep.
but roll it in there.
So is there any chance that I'm stretching and rolling out too much, where I'm messing with it too much? So
Yeah.
You can't like overstretch a muscle.
Well, you can, but it's pretty tough to do that in that situation.
Because I don't want to roll my stuff out my back out too much on the lacrosse ball.
Yeah, the lacrosse ball you're gonna be limited. You know, I don't know if you're gonna do that 2-3 times a day, then you can only do it for 2 to 3 minutes each time, right?
Yeah.
I wouldn't sit there and do it for 10, 15, 20 minutes in your upper back, mid back, and then go back later and do that twice again. You're gonna be really sore. Yeah. The ball though in here and the stretch, the one with your hand, with your finger where you pull it down and raise your arm up, that stretch, you can do just fine 2-3 times a day. That's not like a deep tissue massage like the lacrosse ball is. Okay.
Yeah.
Okay. All right. You can put your shirt back on, and we're going to adjust your thoracic spine. So you're a transplant, right? You went from California to Dallas. What brought you to Dallas?
Work.
Work. Okay. And bend this leg here. How do you like Dallas?
Good.
And take a deep breath in. We're going to adjust your pelvis here, your right pelvis. It's posterior and inferior, so I'm going to bring it back forward a little bit here and relax yourself. Good. Okay, and the other side up. And take a deep breath in. And this pelvis is forward and higher, and I'm referring to the top of the pelvis. So I'm going to grab down lower, the ischium, and we're going to... There we go. Okay. Now lay on your stomach. Let's check your mid-back. So this also helps to alleviate muscle spasms, muscle tension. We did the laser, but I like to do a little bit of this as well. You can feel his muscles a little raised here on the left side of the spine. Oftentimes that means there's a little bit of a curve in the spine, a little bit of scoliosis here. We did not take x-rays because he's only here for a week. And, you know, we may do that by the end of the week, but at this point, we're going to hold off on that just for now. But this is what I'm feeling on this left side. I know you feel that right there too, right?
Yep.
Bend your knees for me. Take a deep breath in. Good. And blow all the way out. And drop your legs down. Good. And again, deep breath in. And blow all the way out. Great. We got a lot of good movement from your thoracic spine right there. And one more deep breath in. And blow out. So you'll notice I'm adjusting him from the left side. It's because I feel like his spine shifts or curves to the left. So that's why I'm doing that. If there is a scoliotic curve and I adjust into the curve, that's going to make him worse, okay? So on your back, please. I'm going to do this side first. I know this side's not as bad for you. Just so you can compare it. Your pec minor right here. So folks, you're watching here under his, kind of under the armpit, the chest area, that's the pec minor. That pulls the shoulders forward and down. Whereas the regular pec major up here pulls the shoulder just forward. So we taught him to do a stretch where you do a tissue pull with his fingers. Here you could do it lying down and then go ahead and raise that arm up. Yep. And then again, do another tissue pull. Yep. And then he can also go under the armpit a little bit. Go ahead. And that gets the, again, pec minor, right? Which pulls the shoulders forward and down. Pec major up here pulls the shoulders forward. We want to hit both of those muscles. So it's good to move the hands in different spots. There you go. Now we're going to loosen that up with this PTLMS machine. And just relax here. This one's going to be more sensitive.
Yeah, it's not too sensitive.
Not too bad? You can stretch that arm out when you do it. Do you have a Theragun or something like that?
Yeah, I got a hypervolt.
Okay. Oh, is that what that is? Okay. Yep. So the ball is effective if you don't have anybody to help you with the mid-back, right? Alrighty. Now let's check your shoulder because that was really off last time. So we're going to pull out this way. I want you to resist me. 1, 2, 3, resist. And that's weak. 1, 2, 3, resist. And that's weak. Was that a little painful? Okay. Compare it to this side.
Maybe that, yeah.
1, 2, 3, resist. 1, 2, 3, resist. Stronger, but how does it feel?
The left?
Yeah. A little uncomfortable, or?
Yeah, definitely. I mean, it's been that way.
All right, let's have you stand up. We're going to check your clavicle because we adjusted that last time. Pull the shirt off. So look at your clavicle. It's off here, right? So again, it's off. All right, so what I want you to do is have a seat right here. And just relax your arm here. So because his clavicle is lower here and higher out here, we're going to lower it from the lateral aspect of the clavicle, or the distal end of his clavicle. There are several ways to do it. If his clavicle was higher up here, I would adjust him at this joint. So just relax yourself here. Okay. Okay. Stand up, face the camera. It's better, not perfect. Have a seat again. We're going to do one more. You okay with your shoulder, by the way?
Yeah, no, it doesn't hurt
Okay.
at all.
Was your shoulder sore, by the way, yesterday?
No.
Good.
Yeah.
Okay.
I'm small, I'm good.
All right, stand up.
I can take it.
All right. It's a little bit off, but it's better, much better. Okay. I wonder if you don't have a problem with this shoulder. Raise that arm up as high as you can. Can you go higher? And try this one. Is it a little restricted on that end? Do me a favor, lay down here on your back. Turn your face that way. Okay, stand up, face me. There we go, good. Okay, and lay here on your back. So what would you say, 5% improvement? Not even. More? What? After one visit here in the last 24 hours.
Yeah, I'd probably say probably 5%.
Okay, so we got a whole week here. I'm hoping to at least improve things 50%. I think that's a good start for him. Relax here. And then we'll transfer him over to somebody in Texas.
Yeah.
Relax here. Okay, you're all set for today. All right?
Cool.
Okay. Day 2 in the books.